Sure. My name's Dana Ferrari. It's D-A-N-A-F-E-R-R-A-R-I. Yeah, I'm a graduate of the program in public health at Michigan State University. I first became involved. I had Dr. Ripp for a undergraduate program here, his epidemiology class, and I got really interested in public health and sort of disease investigation and outbreak investigation through that class. And I was applying to med school, but I wanted to wait a year before going right in from my bachelor's, and Dr. Ripp mentioned that the program in public health would be a really great way to go about, kind of taking a different sort of academic path for a little while before med school. So I looked it over. I thought the online thing was something new. I hadn't had an online class before, but I ended up really enjoying it. It's A.T. Still University in Arizona. It's an osteopathic school. I liked them a lot. It was a very diverse group of people. I think I had a couple that worked directly at the CDC or had experience at the CDC before. A couple of them are veterinarians. I have one that's a lawyer right now. So there's a really great, I think, mix of people. One's doing his PhD in counterfeit drugs. So just the different types of people, I think, that do the classes, it's really interesting. So I think I learned a little bit from each of them, but I liked that they all came from different backgrounds and they all didn't work exclusively in public health. Probably the two that dealt directly with infectious disease and outbreak investigations, I think, were my two favorite. I can't remember the course numbers, but one was a core course and one was an elective that built off of that core one. And then also the two counterfeit classes I had, HM 834 and 833, because I'm trying to get my certificate in counterfeit medication through this program as well. So those are also very interesting. Probably how much public health affects everything you do. You always think of the community health departments that are around, but their actual authority and what they do for the community on top of just like private clinicians was really surprising to me. And the state level, the government level, a local level, how integrated public health is was very surprising to me. I didn't know a lot about it before that. It was very different. I think there's a different aspect of time management that you have to get used to, because I'm used to just going to class and then figuring out when to do the homework later, but at least you always have to go to class and you have to dedicate at least that much time to it. So it was interesting trying to figure out a way to get online and do the readings and then still have the assignments done on time. But I think there's a lot of freedom with these types of classes, because you can do the homework at 2 in the morning if you want. You can submit it whenever. It's when you have time to do it, not when the professor expects you to be at class. So it was nice that you could work your schedule around class time. So I really enjoyed it. Once I got the hang of, how to make sure I got everything in on time and make sure to have all the readings done, I actually really liked it. Yeah, almost all my classes had like a discussion component to it. So if we had to turn in individual assignments, we'd also have to go answer like an essay question or some sort of prompt to where you'd have to talk about it in a discussion forum. And then to receive full points, a lot of times you'd have to reply to 2 or 3 people's posts. So you'd really have to be like interactive and make sure, that you were reading what people were saying and, either agreeing with them or disagreeing, and this is why, and you'd have to present arguments to them and stuff. So it was almost mandatory for most of my classes to interact with other people. And then I've had group projects as well, where you email stuff back and forth and you submit it as a group. So yeah, that's a huge component to most of the classes, I think. I like it because you get to hear a lot of different people's viewpoints. I think the students themselves are really interesting. A lot of people are already in their 2nd or 3rd job in healthcare. They're nurses or they're already doctors and they're going back to get this degree. And so they have a whole other range of experiences to share with people like me who are straight out of their undergrad and haven't really had time to practice, anything clinically or, in the public health world. But you get these seasoned veterans that have worked in public health, for 10, 15 years and are coming back to get their degree finally. And, the experience and the things that they have to say is invaluable to the conversation. So I thought it was very interesting to get everybody else's viewpoints. Right. I think it was definitely a help to figure out, once I got the hang of the online class things, I really liked it. I had the time to do it, and I had the time to dedicate, to really quality work. Whereas, if I had a normal class that something was due on Friday, we got the assignment on Wednesday, you kind of just have to roll with it and, turn in what you can. But they always gave you the assignments way ahead of time, so you had a lot of time to produce quality work, which is what they expect in grad school. So I really liked it. I think it's a big help. I think it's important, especially for future physicians, which I know a lot of people in this program are, to have sort of the population-based background in medicine more than just a patient-centered approach. So I think it's important to understand, both practices and how they work together. So I think it would be nothing but good to have this sort of experience, to be able to think on a population level and then apply it to a patient, or vice versa. You know, if I see a patient who may be the beginning of an outbreak, it's important that I can recognize that.
So it sounds like you have some real life applicability with things that you've learned.
I think so, definitely. I think there's a lot of stuff I've learned that I'll take with me and just continue to build on. Just how awesome it is. I don't know, that sounds silly, but it's really great at just the things you learn that you would never maybe be exposed to in a traditional undergrad program or a traditional, you know, other grad school program. The types of people that you get to work with, you know, your classmates, maybe in Florida or California, you know, not everybody's from Michigan. So they have all sorts of different experiences with different types of medicine or different types of public health systems, and I think it's just awesome to be able to interact with those people where you might not otherwise get the chance to.